Pregnant and breastfeeding mothers come under a special category when it comes to effect of any disease on them. Could be infectious disease or otherwise. Or when it comes to administration of medications, since not all medicines are meant for pregnant and breastfeeding women, and so is it with the vaccines. Understanding the basics, spread of the disease, and outcome of researches so far on SARS-CoV-2 will logically help us to find answers to our questions. Hello everyone, welcome back to my channel, Womb to Super Womb. I am Dr. Samatha with you on this journey towards a healthier you. If you are a breastfeeding mother, you probably have a lot of questions regarding COVID, effects of COVID infection on you and your newborn, if you can breastfeed when tested positive, or you may be contemplating about taking the COVID vaccine. Should it be taken during breastfeeding, and what are its effects on the baby, and many more. On day 5 of the World Breastfeeding Week 2021, let us know about COVID infection in breastfeeding and COVID vaccine and breastfeeding. First, if a nursing mother is tested positive, can she breastfeed? The researchers conducted so far tell us that the COVID virus does not pass through breast milk. So, there is no chance of baby getting infected through this route. And second, the benefits of breastfeeding are huge to baby and the mother. Breast milk is nutrient rich and is the best food a newborn can get and provides immunity to the baby. So, breastfeeding should be continued. You can go back to my video on benefits to mom and me to know the details. As we all know that the novel COVID-19 is a respiratory virus which spreads through the droplets when an infected person coughs, sneezes, speaks, sings, or even breathes through saliva or nasal discharge. So, it spreads through person-to-person contact, and so is the case with mother and her newborn. So, what are the precautions a mother has to take while breastfeeding? First, wear a mask, preferably a surgical or N95, while breastfeeding and handling the baby to change the diapers or putting the baby to sleep. This is respiratory hygiene. Next is hand hygiene. Supposing the mother sneezed covering her mouth with hands, she should wash her hands thoroughly with soap before touching or coming in contact with her baby. Frequent hand washing is very important. Third, breast hygiene. She should wash the breasts with mild soap and water before feeding. Longer the duration of contact of the infected mother with her baby, higher the chance of spread. So, limit the contact as far as possible only to breastfeeding schedule. Ask your spouse, close relatives, friends, caregivers to help you with your baby until you are tested back negative. But remember to follow hand, respiratory and breast hygiene every time your baby is near you. If the woman is seriously ill and unable to breastfeed, she should pump the milk, and this expressed milk can be fed to the baby by the caregivers. Can a nursing mother take COVID vaccine, and is it safe for the baby? Yes, current guidelines of our country and across the globe have been recommending nursing mothers to take the vaccine. I have spoken about the benefits of taking COVID vaccine and how benefits outweigh the potential risk of encountering COVID infection and its complication in my video on Should I Take Vaccine in Pregnancy? Do give it a watch. When a woman gets infected with the virus or when she takes vaccine, her body produces antibodies as an immunological response to the foreign body or antigen. So, antibodies give her immunity from future infection, and the antibodies produced in the mother's body can pass through the breast milk to the baby. Since COVID vaccine is not a live vaccine and vaccine particles are not seen in breast milk, only antibodies are seen based on the research so far, it is recommended to be taken. If a woman takes the first dose of vaccine soon after childbirth, can she breastfeed until she is due for the second dose? Yes, she can. Whenever you take the first dose of any vaccine, your body produces antibody. One dose of vaccine also gives you good protection. But the memory created against that antigen in the body reduces through time. And hence, second dose or a booster dose helps to increase the immunity back again to a sufficiently protective level. So, you are good to go ahead with breastfeeding. Should I continue to feed the baby if I develop flu-like symptoms post-vaccination? Flu-like symptoms soon after vaccination are mild and do not last long. Fever may develop a day or two after your vaccine, and it could be just the immunological response of your body to the antigen. Such an immunological response after vaccination is normal and not an indication to stop breastfeeding. If a woman has already been infected in pregnancy, should she still take the vaccine while breastfeeding? We all know that our body naturally produces antibodies following an infection. Although there has been past infection with COVID, it is recommended to take the vaccine, as vaccine becomes a booster to the innate immunity developed following infection. If you have had the infection, you can get vaccinated 12 weeks following infection or 8 weeks following recovery. Before I sign off for today, I want to tell you that the information I have shared in this video is based on the interpretation of various clinical studies conducted so far across the globe and is definitely the area for further research. Hope you found the video informative. Stay healthy and stay tuned. Thanks for watching.